Hey guys, welcome to the first lecture of this probably new style for many of you. This is going to be the probably a shorter lecture of all of them. We're going to cover chapters 1 and 2, and I just want to kind of get you used to the process. So you can kind of tell me what's working, what's not. Does the audio work? Does the video work? Does the style work? Just a few tips on how people do these. Some people just put these on their phone and listen to them while they're washing dishes. Literally, I've had people say that's when they when they do the lectures. Other people watch along with because they like the sort of visual and audio learning together. Some people use the YouTube function of speeding it up ×2, and then they watch it twice so they can kind of get more information. Other people slow it down a little bit and really take their time with it. You guys get to choose how you want to consume this and what works the best for you. I am going to kind of reference the book sometimes. And I used to have a camera that I could like show on screen up here and point down at my book. And I don't have it all set up right now. So I can't really do that, but I will reference it. So you may want to get your book and have it handy. If you don't, it's not a big deal. You're not going to miss out on too much. Eventually, there will be some lectures where I will try and get my camera set up so that I can show you the book while we're talking about it. But it's probably going to be the most helpful if you get your book and have it in front of you while you're doing this too. So for what that's worth, I'm going to jump right into it because I'm going to assume that I'm recording this before I've even had the first class. So I'm going to assume that we'll cover sort of the basic foundations of assessment, although I might be a little redundant depending on what we cover that first day when I'm with you guys. So let me pull up the lecture here. Where is it? There we go. Found it. I'm also captioning up there too. It's a little different captioning style than I'm used to, so I'd love for some feedback on whether that works for you, whether it goes too fast or whether it's just distracting and not useful, whatever. But I've had several people say it's helpful to have that there, and others say I don't need it as long as I have headphones in, but if you're listening to it like on a computer screen, those can be a little bit different or difficult to hear too. So anyway, for what it's worth, you figure out if you need some help with it and it's not working, I'll help you figure out a good system. So this is not even the first slide. I don't know how that happened. This is the first one. So let's talk about assessment just very generally. What is the purpose of assessment? The purpose of assessment is to gather information. That seems probably pretty obvious, but there are so many different ways to gather information and different reasons to gather information. So we're going to be covering a bunch of those. I'll talk about some of them here today. We're going to cover a bunch more of them as we go through the class, and you'll get to decide what ways am I going to use assessment? What tools do I need to accomplish that? And what is the purpose? Like sometimes it has to do with the referral source. Like if a client is being sent to you from somebody else, like the court system, what do they want to know? Well, you're going to have to assess the kind of things they want to know so that you can report on it. If you're seeing individual kids in a school, the teacher says, oh, this person's behaving poorly in class. And you're like, well, what kind of behavior? So you want to do a behavioral assessment. If you're in private practice and you're seeing a couple and the couple says, we're contemplating divorce, you're like, well, I should probably find out what is causing this discord or what things are getting in the way of their healthy, happy marriage. So there's lots of reasons for assessment and lots of ways of doing it. Overall, the purpose is to gather information from other people that you don't have. Now, we'll get more into this later in terms of the methods. This will be next week. But sometimes you can just ask people questions. And I probably would say the great majority of counselors typically just rely on their ability to ask questions and say, if I ask a person, how do you feel? And the person says self-report, I feel bad or good or whatever it is. If they report that, we take them at their word. However, when you ask somebody, what's the quality of your memory? How fast is your processing speed? People don't know that, right? And sometimes we use other kinds of tests to get at those kinds of cognitive functions. So there are a lot of things that people can self-report, and there's also many things that people can't self-report. They don't know about themselves. So part of using all these tools, and some of which we'll cover in the class, is we want to get at the things that people have access to and also the things that people don't. So there's a lot to cover there, but that's just the general idea. As it says on the screen here, of course, we want to know about treatments. We want to find the right problem. We need to make a proper diagnosis, choose the right interventions, all that kind of stuff. One of the analogies I use sometimes is if you go into a doctor's office and you have a broken leg and you flop your leg up on a table and it's clearly broken and you say, "Okay, doctor, what's wrong with me?" And he says, "Well," looks at your leg, moves your ankle around a little bit or whatever, and then he sticks a popsicle stick or whatever those things are, a tongue depressor, I think they're actually called, puts those in your mouth. And he says, "Well, I think you probably have a common cold." And you're like, "Well, what about my leg?" Obviously, it's kind of a silly example, but his assessment is incorrect. And he says, "Well, I think you have a cold, so I'll give you some cold medicine and send you home." Well, he's improperly assessed the problem and he's giving you the wrong intervention. Same thing applies with counseling. If you don't accurately assess what the presenting concern is, or what the problem is, or what the struggle, where the pain is inside of somebody, if you don't assess that accurately, then you might just slap on a little CBT or a little existential counseling or a little bit of your own methods, but you might get it wrong. And so that's the point of why we do this and why we want to get better at being accurate with it. The other part to this kind of relates to terminology, and I'm going to point to the second bullet point, but also this bottom one down here in terms of like definitions and how we talk about assessment. Start down at the bottom here first. The way the book defines assessment and testing is if they're two different things. We use a bunch of terms around here: testing, assessment, evaluation, appraisals. By the way, appraisals is a term that I never heard before I moved here. I think it's kind of one of those old terms that had been used a lot in the past. I just don't see it in any of the literature that I look at or the way people talk about these things. So, but there are lots of terminology, several different terminologies we use to talk about this. I'm going to essentially talk about them mostly interchangeably. There are subtle differences and people can argue about those as an academic exercise, but I just don't care that much. So we're going to talk about assessment in general. The way the book describes it is testing is sort of the process of using paper and pencil or computer to like gather information, and then there's like an initial administration phase and then a scoring kind of thing, and then an interpretation from the expert's perspective. Assessment is what bullet point 2 talks about, which is it's this ongoing fluid process. It's dynamic, which means you can add new information anytime from the client that changes the outcome of what you might be working on or the interventions or something like that. And it happens continually throughout the whole relationship. So for example, typical scenario. We'll give you 2 examples. One of them, you're in a private practice or whatever, and let's say you're working at like a hospital. You have an agency setting, and you get sent this big file full of information about this client, and the client shows up on your calendar, and you're going to meet them in an hour. So you filter through all of this initial information that you got from client's record, and that's your first assessment of who they are based on other professionals' evaluations and notes and that kind of thing. And then you do your own assessment of them when they come in for the first session, and you get to talk to them and understand from their perspective what is going on, how have they lived, how are they currently feeling, all that stuff, right? After that, you might say, well, that diagnosis that was in their record from long ago, it doesn't seem to be accurate anymore. I didn't read that. I didn't pick that up from them. So I'm going to use another tool to gather symptomatic or diagnostic information, and I'm going to use a formal tool to assess the diagnosis because the assessment of past history doesn't seem to be accurate. So we're using different kinds of gathering information to do that in this ongoing way. Let's say you do that formal evaluation, you give them a diagnosis, then a week later they come back with a different symptom presentation. Like they were depressed in first scenario, a couple weeks later they're manic, and you're like, oh, that major depressive disorder diagnosis doesn't seem to be accurate. Let's look into bipolar or something like that. Just an example, but you get the idea. Things can change throughout it, and there's lots of different ways of gathering information. Scenario 2, let's say you're working at a school and teacher is like, I am so fed up with this girl. She keeps acting out in class. She won't pay attention. She's shooting spit wads out of her pen or whatever kids do. Probably just sitting on her phone or whatever. I don't even think you can have your phones in class anymore, but you get the idea. She's not behaving up to the teacher's standards, right? And then you meet this girl That's your first assessment is from teacher report. Then you meet this girl and you find out she hasn't eaten in a day and a half and her home life is kind of tumultuous, and you're like, you help her get some food, and then she calms down and she opens up and talks to you, and you find out assessment is she a behaviorally problematic child, or is she just hungry and she's not getting her basic needs met at home? So uh, I'll kind of stop it there and make that example short, but there's lots and lots of different scenarios that we need to kind of go through the options of what could possibly be going on, and then always be open to changing our mind if new things come up. Okay, so I think I've already covered the third bullet point. It's way more than simply giving a test. It's this ongoing dynamic thing. And then I've already basically described this fourth bullet point, so we'll just skip past it. But the one thing I will say is that when it comes to doing informal assessments and just asking our own questions, if you've been to a counselor before and you're like, they're not doing anything important other than just sort of like talking to me, and they're just sort of like asking me how I'm doing, and it doesn't seem like they have like a very systematic and procedural way of doing things. Excuse me. That might seem like that on the outside, and yet here we are training for years on end and then getting clinical hours for another couple years on end to train ourselves to know what we're looking for and to know what kinds of questions get the kind of information that we think is going to be the most helpful for the client, or the most helpful for getting us what we need to know in order to do treatments or something like that. So in a way, it doesn't seem like it's systematic on the surface, and yet there is a process. And I'm not going to say a ton about this right now because we'll go into this in a lot more detail later. But when you go to your theories class and you say, okay, well, I'm really interested in this cognitive therapy of Aaron Beck and all these cognitive distortions. So when the client comes in and you say like, whoa, what's on your mind? And you're guiding them towards these cognitive kind of responses. It's not just an accidental, what are you thinking today? It's a purposefully, if I understand what's working and what isn't working in their thought patterns or their different schemas of how they organize information in their head, then I can find out areas where we can work on things, right? Alternative example, let's say I'm an existential counselor and I say, tell me your story. What's meaningful in your life today? And instead of looking at cognitive thought patterns, I'm focusing on meaning making in the process of what are they focusing on? What elements? Similar to like narrative therapy. If I'm saying, tell me your story, don't, start from the beginning or any point when you feel comfortable and let me know, a little bit about you and your past and what's leading up to present concerns, that kind of stuff. You get to see what details people focus on in their story, and then you can choose an intervention to help restory, it's a narrative therapy term, restory to look at their past differently, and which essentially means redefining my self-identity of who I think I am and who my family was and all that kind of stuff. So it is systematic in the sense that we're using it here. It's not systematic always in the sense that we're using a paper and pencil and there's these bullet points and or number Scantron sheets and like ordered questions. It is that, but it's also the other thing. Moral of the story, we're collecting, we are still organizing, and we're still making meaning of data. When we get into the statistics stuff in a couple weeks, I'll show you how do we mathematically organize and manipulate data to give us new meanings. That'll make sense to you in a little while. But in terms of how we do it in conversational style or like an informal assessment, the questions that we ask, the way we ask them, the way we build rapport with people, the focus of cognitive or existential, that kind of stuff, all of that is also systematic. And it's important to understand that what you're doing, what sometimes might feel like, I just do it, I don't know why I do it, it is also a trained, habitual, systematic kind of thing. It's for the same reason that athletes practice their dribbling or, practice catching and throwing or shooting or whatever they do, because they're trying to systematically make their body repeat successfully a certain kind of action, something like that. That's what we're doing too. So anyway, again, lots of purposes for assessment. One of them is for screening, which is usually done before the relationship is established. It's usually quick and simple. Most of you understand what screening is. If you've ever been to a doctor's office and you fill out on a computer or tablet or on a clipboard or something, They have a health questionnaire, a family history, that kind of stuff. That's all just screening to say before you even see the practitioner, the counselor, the doctor, whatever, can you give them information that is pretty easily self-reported? It doesn't require explanation. It doesn't require expertise to administer. So you'll see some of the assessments that we'll use in a couple weeks, like the Beck's Depression Inventory, the Generalized Anxiety 7 question, or the GAD-7. Some of those kinds of things, they often get used as screening tools because most clients understand, for the most part, what they are being asked and can self-report that pretty easily. And yet, we'll also cover what might they be missing and how much can we trust the results, and what kind of ways can we use those tools in a different way so we can gather a different kind of information. In some ways, assessment is used for identification and diagnosis. It doesn't, when I say the word diagnosis too, well, I'll try and repeat this throughout the semester, but I don't just mean DSM mental health diagnosis. I also mean, if you have, let's use a couple again. If you have a couple that come in and you have been just freshly trained in the Gottman perspective, and you know all about the 4 horsemen of marital conflict, or 4 horsemen of communication. I don't know all of them at the top of my head, but one of them is blaming. Another one is like contempt. If you're speaking with contempt to your partner, those are things that get in the way of healthy interactions and positive progress and relationship making. So if you know you're looking for, do these kinds of things exist, and you want to sort of diagnose the couple and where correctly, accurately diagnose or figure out where the problem is, then that is kind of the same process of asking about symptoms and giving the problem a name. Gottman just calls it something else. He calls it blaming. It's not. It's just the process that we use to get at a name that we can call this problem. Another example would be if you are working in a high school and you have some kids who are going to college, and you're like, well, what kind of major do you think you'd be interested in? And let's go talk to that specific program. And they're like, I have no idea. So you do this career evaluation and you find out that parents really want Susie Q to go, sounds so old fashioned when I say Susie Q. But they want Susie Q to be a lawyer because they're both lawyers and they think it's the best job in the world. And Susie Q wants to go to art school. And she feels this pressure because she wants to make her parents happy and they're going to pay for it. So she feels like she has to kind of go that way. You're maybe starting to get a picture or a diagnosis of where some conflict might be when you go with her to visit the art school, but then you kind of go to the law school and she feels a little bit uncomfortable about the whole thing. And hopefully you get the idea here. Diagnosis doesn't just mean DSM. It doesn't just mean mental health condition. It means accurately assessing where the problem is and what's holding a person back or creating dysfunction or something like that. Third bullet point, I already kind of mentioned that intervention planning, or if I make an accurate diagnosis, I can provide the right kind of treatment based on how I'm understanding the situation, given the client's feedback. So intervention planning is just another way of saying choosing the right intervention or the right treatment or something like that. And then progress and outcome evaluation. One thing that I don't typically focus on, and sometimes I forget to, is that mostly because I come from more of a humanistic perspective. And although you might disagree after this class or even now, who knows, I have had to work really hard to think like a scientist. So when a scientist says we need baseline evaluation information, and then we can, at different benchmarks, we can update and check on progress. So if you give a client the PHQ-9, which is a patient health questionnaire, essentially a depression inventory that we'll look at later. If you give the client the PHQ and you say they have a depression level of 16, and then you give them 3 weeks of intervention, you check again and they have a depression level of 12, and you're like, oh, the treatment seems to be working. The symptoms are reducing. You can do that and then set goals of like, client feels like, this is not necessarily realistic, but client feels like if they reach a level of depression level of 7, they can reduce treatments to once a month as opposed to once a week or something like that. But you get the idea of like, you can test progress and you can physically see or quantitatively see progress or regress or whatever the situation might be. So there's a lot more that we could talk about there, but we'll leave that for now. When I mentioned that there are lots of different methods, I've already kind of been describing some, and this slide essentially just sort of gives name to a lot of that. Most of you are probably anticipating doing unstructured interviews, which means you sit down with the client, go through your informed consent speech, and you do all that kind of stuff, and then you say, "So, what's going on? What hurts? What brings us together today?" or whatever your phrase is. And they start talking about something, and you're like, "Okay, this gives me information about what direction we might want to go with this." So starting with a very open slate or blank slate, unstructured process can give you some indication of where you're going. Some of you might say, I work in a setting where I'm referred clients for AODA concerns, or alcohol and other, what does that even mean? Alcohol and other drugs. I don't even think that's right, but I should learn the acronym. But it's addiction stuff, right? And someone is referred to you specifically for methamphetamine use, and you say, "Well, we want to go through this semi-structured interview, which means I have these set questions that I'm going to ask you because I have to ask all clients these, but we can also deviate a little bit so I can dig into the background or ask for additional explanation or something like that." Versus a structured test, which is something like kind of show you some examples later in the semester of intelligence tests. It's really important that every administrator say the same words in the same way, not provide a whole lot of feedback in terms of my facial expression or the words that I use, because the administration of the test can influence the person's answers. And if you want to compare one person to another person, you don't want to give somebody an easier version or more favorable version. So the administrator is taught to be very structured with it and not provide a whole lot of cue in return, which typically as counselors, we're not really comfortable with that process a lot of the time. And yet it does some very valuable things in terms of different kinds of information we can get. So I'll show you some examples of that, but we're not going to dig too much into those. Probably one of the hardest and most frustrating and miserable assignments that I've ever given and will continue to give for a while is the CAPS 5 PTSD or trauma semi-structured interview. It's this questionnaire where it very formally guides you through the process of asking about the DSM diagnostic criteria. And you guys will kind of get a feel for that and how it feels to do more like structured interview questions and that kind of thing. So we'll get a taste of some of those different interview methods. I'm going to fly through some of these a little faster, but standardized tests, you guys know what those are and know how you feel about them. You can make your own inventories if you are specializing in domestic violence and you're finding out that a lot of people are reporting the same kind of issue. You might say, I'm going to have a 3-question thing that I'm going to offer new clients just to sort of see if they're experiencing the same things that everybody else is. You can totally do that. That's very okay. You might have a checklist, especially at the beginning. For example, the outcome questionnaire, the OQ that you're going to be doing in practicum. It's just a checklist to make sure you gather all the information that you think you need and don't forget to ask certain kind of questions. It's just a memory tool or something to expedite the information gathering. Questionnaires, projective drawings, which we'll talk about later towards the end of the semester. Work samples are less relevant here, but in my rehab days when people would come in and say, I want a job at a factory, but I don't have, I only have one hand and it got in an accident. And so we do a work sample thing to see, can you actually perform the tasks with your hands fast enough to do this job that you want to do? Otherwise, it's just going to be miserable trying to get the job and then having to quit or get fired or whatever. So it's not just mental tests. There are some physical tests that we can perform too, kind of. So I won't go too much into that one, but lots of different kinds of tests. Observations, we'll go more into this later too, but rating scales, event recording, duration recording, time sampling, raw notes, anecdotal records. I'm not going to describe what all these things are, but you know what observations are, and I think we'll dig into this a little bit more eventually too. Part of what you get to do as a counselor is you get to watch people's behavior. You get to report themes from what you're hearing from them. You get to report patterns over time. And so we do a ton of observation, both physically and verbally, visually, all that kind of stuff. So I'm not going to dig too much into that because we'll get a lot of practice. Like, how do I say this? I think you probably will have already heard me talk about this by the time I say this again, but I'm going to reiterate it here. That one of the things we want to do is we want to train our body to know what to look for so we don't have to think about it. Go back to that analogy of the athlete. That person dribbles a soccer ball or runs their wide receiver route or whatever. I don't really do sports that well, so if I use these terms wrong, sorry. But I'm practicing. My wife makes me watch football every Sunday because she loves the Packers. She grew up here in Wisconsin, so I have to watch the Packers. So I'm learning about like what a what do you call it? Like a screenplay is. I don't know what that is, but I know most of the rules and all that kind of stuff. But anyway, we're not here to talk about football. But that athlete practices over and over and over again to build a kind of muscle memory so that when the big game comes and they jump up to catch the football, they don't have to think through their head, okay, jump hard, run faster, jump at this angle, put this much force into it. Like, you don't want to be thinking about that kind of stuff. You want to be able to just do it. So as we're learning about all these different observational styles, what we're really trying to do is build this intuition or kind of like a gut feeling of like, what am I seeing? And am I training myself to see certain kinds of things that regular people, untrained non-counselors, they just don't see it and they don't understand what they're looking for. One quick example would be, as you're learning about the developmental process of people and how people develop social connections and emotional maturity and those kinds of things over time, not everybody understands what emotional task we're supposed to be able to accomplish in terms of like, how much of my emotion can I regulate? And do I know when I'm dysregulated? Lots and lots of people come to counseling for that very reason, because they can't figure out why they can't hold a relationship. Well, as it turns out, every time a person tries to get close to them, they push away and they feel this sense of panic and they can't stay in a relationship, and they come to counseling for that reason. And so we're here to observe, oh, I'm noticing that when you tell me about these past people, as soon as they started to get close, you started to push away. And I'm simplifying quite a bit here, but that's specialized knowledge that we want to be able to intuit or have a gut sense or intuition for. Okay, sources of client information. We're going to be talking about this a lot more throughout the semester, but the client is obviously the big one. Collateral sources is just another word for other kind of places. So a person might come in and have a spouse that provides some kind of information. Sometimes it's consistent, sometimes it conflicts. If you're working in schools, you could have parents that provide information, teachers, not teachers, family members, but they're all kind of personal sources. Teachers would fall into the second category, which are professional sources. So teachers, an example, obviously, past counselors. My previous example where you get a pile of records on your table could be past doctors, occupational therapists, any of those kind of things. And then, of course, down at the bottom here, we have records that you get to read. If you're doing like marriage and family kind of work, obviously you're going to be getting information from multiple different family members, and you're going to be gathering oftentimes conflicting information about the roles of the different family members. That's one of the assessment methods of marriage and family therapists, is sort of, what is the structure of the family if you're a structural therapist? Which roles do people hold? What do those different roles mean to the various people in the family, that kind of stuff. So anyway, that's probably enough for now. We'll go into more examples later. We may choose to talk about this in class. So if you're thinking to yourself, this is the kind of professional that I want to be, what kind of methods am I likely going to use? That's a good question to bring to class, because then we can kind of tailor how you're engaging with this material specifically for you, and we can answer those questions too. Okay. The assessment process, again, some of this feels a little redundant, so I'm going to try to not be redundant as much as I can. But first, we want to identify the problem. in order to do our counseling, treat, provide services, you need to understand the problem. Okay, we've already kind of been there. Selecting methods. This is one of those things where sometimes that happens consciously and sometimes it doesn't. If you're getting trained to become a counselor, probably a lot of your assessment methods, which basically involves like, how do I ask questions? What kind of questions am I going to be asking? What kind of information is important? By the time you get out to practice this stuff and practicum and internship, you're already going to have a sense of what I'm selecting here, what kind of information is important, family background, emotions, thoughts, behaviors, that kind of stuff. So you don't necessarily always have to select. However, if you're required to diagnose, you may have to select specific tools. And so can you find enough information through other means like self-report, through interview, or do you need to use a specific, like a Beck's depression inventory, a CAPS-5, like we're going to talk about, or a myriad of the other tools that are available to us? I've already kind of explained this example of like, you can't really get at cognitive capabilities. I used to use this example. I stopped doing it, although now I'm going to do it again because I thought it was funny and maybe it's not funny. I don't know. But if you're trying to understand a person's cognitive capabilities, if you're a neuroscientist or like a medical doctor, you can literally you probably have to get permission, but you crack open a person's head and start taking a toothpick and poking at their brain and saying, which part of the brain does this? If that's what you're trying to learn, you get to sort of like physically find out what part of the brain is responsible for the various body functions or whatever. But we don't have the luxury of physically being able to go inside a person's mind. It just doesn't work that way. But that's what we're trying to understand. So we want to understand people's emotions, which are difficult to assess because we can't see them. We can't taste them. We can't use our senses to get at them. Same thing with people's thoughts. We can't get access to it. We can't take an axe and like chop their head open and be like, oh, I see what the problem is, It just doesn't work that way. So we have to choose, how do we get information out of in this relatively inaccessible way? In the beginning of the therapy days, Freud would say, well, the only way to do it is to sit on a couch and free associate for a long, long time until the expert therapist starts to reveal some patterns and things bubble up from the unconscious that the therapist can say like, oh, so you're telling me about this dream and that represents the symbol, which represents the thing. And that's what we thought. Now we have a little bit more scientific and sometimes seemingly complicated, but sometimes relatively simple too, ways of getting at things that we can't see, taste, and touch. So that's essentially what this is saying. Let's skip that, the next bullet point there. Evaluating assessment information. Of course, if you're using tools, sometimes the administration of these tools is exceedingly easy. Like even the most basic ones, the Beck's depression inventory, the GAD-7, the MAST, the DAST, those are two. The DAST is the drug survey, essentially, and the MAST is the Michigan alcohol survey. So different, pretty basic self-report tools. It's easy to give them. If I'm a client, I can kind of see what it means, but our expertise comes from interpreting them. Sometimes you do that with the client. Sometimes you do it without the client present. That just depends on where you are and what you're doing with the information, that kind of stuff. But evaluating that is really where a lot of our expertise comes in, not quite as much the administration. One little quick side note about this class, the administration, we're going to learn some administration of tests. Like we're going to get to practice a few of them, but we're not going to get to practice a whole lot. What I'm going to ask you to do is get practice with a few different ones that you think you're going to likely be using, probably, maybe. And then because we don't know where all of you individually are going, and we don't know exactly what kind of training and practice you need for your settings, it's really hard to require you to practice specific tests. So I'm going to give you a sample of all these different kinds of methods. And my hope is that if you learn a few different kinds of basic foundational skills, you can go pick up a new assessment quicker, learn it, learn the process of it. That's the intention here. What that also means is that based on the theory you choose, I don't know all the theories, but I know some of them. I don't know all of the assessment methods. I don't know all of the different sites that people are going to be at. So what you're going to have to do is take the information that we do here, learn here, and gain more expertise, including understanding how to interpret that kind of information. Okay, so I can give you, I can lead you to water, but I can't make you drink, so to speak. So I'm going to give you the foundational stuff, but there's a lot more in terms of interpretation that you'll want to learn. So, and then reporting and recommending. Once you're done with giving the assessment, interpreting what that means, then you get to say, what's the intervention, what's the treatment, all that kind of stuff. That's going to be largely based on your experience and your professional judgment, that kind of intuition that you have and what you do with that information. We'll come back to this thing about referral questions some other time. We'll get to that kind of mid-semester. It's really hard to explain that until you practice it. So that's why I'm going to come back to it. But essentially, if you're getting clients from drug court and their referral says, well, this person's going to be punished unless they go through this program, and part of the program is assessing their level of alcohol use risk or something like that. And we want to know if this person's likely to reoffend. Well, then you know very specifically what kind of information you need to find out. Are they likely to reoffend, right? If somebody calls on the phone and sets up an appointment and you say, give me just like in a couple sentences what you think you are looking for in counseling. And they say, well, my husband is, he has problematic philandering problems or something like that. And then when they come in for counseling, you can be like, well, I think I know we're going to be talking about some infidelity here or something like that. So the referral is being made for a specific kind of thing. Doesn't mean your goals can't change later, but those are important to know what you're going to be eventually working on later on and what kind of treatments you're going to use. So, okay, I want to see how much we got left. We got 2 slides left and a couple things I want to show you on a website. And so I'm just looking at the time and I think we're doing okay here. I thought it was going to be shorter, but I always say that and then I go long. By the way, the great majority of these lectures, I seem to be, I don't know, maybe it's just my own personal habit that just unconsciously happens, but I dial into right about an hour long. So they're all going to be kind of roughly right around that place. If you open up to page 11 or 12, I have my book here too, so I'm going to be kind of referencing this. Page 11 and 12, if you read through that list, let me kind of get to it myself. If you read through that list, essentially, this is the kind of stuff that I'm going to be, 1, teaching you in the class. Some of it, we're not going to be able to get to all of it. 2, if you know these competencies, you are going to be set to understand how to deliver the majority of different kinds of tests, from the most basic to probably the most complicated. And then, I don't know, there's just a lot in here. Also, let me just say this here too before I make my full point. On page 30, 31, 30 and 31, there's another list. I don't know why these lists are separate, but there's all these different things from, like, number 3 says compute and apply measurement formulas such as the standard error of measurement. We're going to do that. The Spearman-Brown prophecy formula. We're not going to go to that level of statistics. But if you can do all these things, you will be a very much competent and adequate assessor or evaluator, somebody who can pick up a test and know what to do with it. My goal for this class is kind of, generally speaking, I'm going to teach you most of these things. And even if you're not competent or skilled in the use of them, you'll at least know what they are and know how to get that training. When it comes to counseling, I set up the class because this might be redundant again because I may have told you this already, but I set up the class so that you can pass your national exams, so that you can be competent in ways that exceed the national averages of what other students know. And I kind of have a sense of what those are and how to teach that now because I've done this for a little bit. But more importantly, I want you to be ready for practice. When I talk to people who are out in practice and the kind of assessments they're doing and the kind of work that they engage in, I want you to be able to engage with the statistical and the scientific parts of this well enough to make good, informed clinical decisions. So I don't need you to know how to compute standard error of measurement. It just doesn't seem as relevant to me, except for a very slight few of you who may be involved in specific scientific projects or more complicated assessments. But for the great majority of you, those kinds of calculations just are not as relevant. So when we get to the stats, you'll see why I'll teach you about the Spearman-Brown prophecy formula, and I'll tell you what it is, but I also don't think you need to know how to get at it, because most of you just are not going to need to do that kind of stuff. So you can look through that list though, and your goal, if you say, I really want to be good at this assessment stuff, there are 2 lists. Also, on page 32, in terms of the ACA standards of what the American Counseling Association thinks you need to know, when I set up the class and as I teach through this, I am going to cover all of that stuff. So you should be able to come back after this class and say, I've looked at the course objectives, I've looked at the standards of the field, I've done some practice testing in terms of like getting ready for the national exam. And if you can come back and say, actually, I feel like I kind of know the competencies. Nobody's going to feel 100% confident because this stuff is scary and difficult and hard. But if you pass the test, you will have gotten the majority of these competencies, because all of these skills are essentially baked into the tests and licensing requirements and educational curriculum and all that kind of stuff. So if you're here and you look at those lists, you're probably getting this information, even if those lists look a little bit overwhelming and sort of difficult to achieve. I promise you by the end of this, you will have been given this kind of information. What you take out of it is kind of up to you, but at least you'll have it there to reference later on. Okay, and finally, well, almost finally, this testing qualifications is kind of one of those, it's a big topic in terms of the legalities and the ethics of using tests. So I've referenced a couple times now these really basic tests like the Beck's Depression Inventory, the Patient Health Questionnaire, that's the PHQ. These kind of things get handed out at doctors' offices by people who are untrained in assessment. They're untrained in mental health diagnosing and all that kind of stuff. Because they're sort of low risk, right? When there's a low risk to clients misunderstanding information, to misrepresenting the potential outcomes of what the test means, these tests have potential to do harm, right? But if there's relatively low risk, then it doesn't really quite matter as much whether the test shows up on the internet, whether it's available to potential clients, or whether it's administered by somebody who is not trained in administration of complicated psychological assessment, right? So people have looked at these tests and say, which ones have potential to cause harm? Just like you wouldn't want a family practice doctor cracking open your head and performing surgery. You wouldn't want, a fellow military officer amputating in the field. Like, they're just going to mess things up, right? Like, it's just not the way it's supposed to happen. So testing qualifications is something that's been relatively highly politicized and relatively regulated. And I say relatively, we'll talk about some of the nuances here probably when we get to class, but there's controversy over what kind of experience and training is enough in order to make sure a person is qualified to teach or to administer certain kinds of things. I just admitted to you on camera, on recording, that I'm not probably going to get to the level of specialization or meet the standard that this book is asking us to go to. I don't think you need to be able to calculate and, know the math of how these assessments were developed and certain reliability and validity calculations in order to make clinical decisions and perform treatments with people, perform interventions. It's just not something I think is necessary. Other people are going to have different opinions about that. I've had conversations with people within the profession, counseling. I was told by a psychologist once that I was unqualified and incompetent, not able to perform certain evaluations because of my professional training as a counselor. So there's lots of disputes about what is enough. What you see on the screen here, this level A, B, and C, is kind of one attempt to help regulate what tests are safe in the hands of whom, okay? So I'm going to give you the rule of thumb explanation, then I'm going to give you my caveats, and this is going to be a hard one to tease out over time, but I'm going to try and help you the best I can to understand this. If you look at this just generally speaking, what most people interpret level A, B, and C as. Level A is if you've been trained at the undergraduate level or below. maybe associate's level 2, you can perform level A tests. I'll explain more about what level A tests are later, but most often you see this leveling if you go online and you look at like the Pearson website. Pearson is not only a publisher of books, but it's also, they have a test publication website where they sell tests. Another one is PAR, or PAR.com, I think is their website. I'll probably show you in a couple weeks. But you can go buy tests there. In order to buy them, you have to have been trained at a certain level. So there's kind of this level of protection over the test. But undergraduate associate for level A, graduate level for level B and master's degree level, or special training, as it says here. And level C is essentially doctoral level work. Now, here's the thing. If you have a master's degree and you spend, you get your graduate degree, and we don't necessarily cover some of the more challenging, difficult kinds of assessment, like intelligence scales. We're not going to go into how do you perform an IQ test, kind of. We'll do a little bit of that, but not too much of it. So you won't be able to do like a neuropsych evaluation. But if you work under a psychologist, let's say at a hospital, and you administer tests for a long time, and then you take a few special trainings through the American Psychological Association or some other credible place, or the American Counseling Association, whatever it might be, you take special trainings and you spend some time getting experience under the supervision of somebody, you can totally do one of those assessments. You can totally do an intelligence assessment or personality assessment. You can become qualified to do that. It's not just through the formal educational process. So the keys to, can I do it? Have I been trained by somebody who's experienced? Have I been supervised in the practice of these things to up to the point where I am qualified? If you can say yes to those two things, you probably can justify the purchase or use of those tests. Now, there's not a whole lot of policing or regulation that goes on, but there is some. And so there will be limitations in terms of what you can buy and where you can conduct these and who will accept them. Specifically, if you're working in like forensics, you're going to get involved in, like, the court might say, what makes you qualified for this kind of test? And you'll have to explain these kind of things. So in your day-to-day work, you probably won't need to worry too much about this in most settings. But the reason I'm going through it here is because it's part of the history of counseling in terms of showing the rest of the world, specifically the field of psychology, that we are legitimate, we're credible, we're practiced, we're trained, and we can do these kinds of things. How we show that, part of that is what you're learning here, and part of it is what you're going to be specializing in and getting additional training and experience in later. So this part is confusing to even talk. It seems like it shouldn't be. Why can't we just use the rule of thumb and move on? Because the reason I'm giving you all this extra stuff is because many of you will leave this class and feel like, I'm confused. I don't know what I've learned and what I haven't and what I can use and what I can't. My goal for this is for you to say, I have some sense of what I'm capable of and what I can learn and what I'm allowed to do. Okay, that's going to be the next thing we're going to look at is, according to the state of Wisconsin, what am I allowed to do according to the laws? In other words, not only has the profession through these textbooks said, here's what you can do, not only have the publishers of these testing agencies said, here's our process of what's okay and what's not okay to purchase, but each state gets to determine their own laws in terms of what do we not want to subject our constituents to. The citizens of Wisconsin, we don't think counselors or social workers or psychologists or regular people who are unlicensed, these are the things they can do and these are the things they can't. Okay, so there's all these different sources of who says you can, who says you can't. So we're going to try and tease that apart a little bit. The last thing here that I'll cover really quickly before we move on to those statutes, the Wisconsin statutes, are is this last part about an ethical issue in assessment is informing the client about what the assessment is for, where the data goes, and what the results mean. We're going to talk a lot more about that when we get to the chapter on communicating assessment results. So hang tight on that one. There's ethical issues to be talked about. You can ask questions in class if you want to. Otherwise, we'll get to that more in a little bit. So let me switch over to this, and this will be the last thing I want to show you. Okay, if you've had a class with me before, some of you have, some of you haven't, but I'm going to real quick, briefly overview the difference between laws and rules, or sometimes I'll refer to them as statutes or administrative rules. What you see here from the Wisconsin State Legislature, see if I can zoom in a little bit more. That's better. What you see here from the Wisconsin State Legislature are statutes or laws that have been enacted through the governmental process, through Senate and House and governor and all that kind of stuff. These are laws over the state of Wisconsin. What you see here is another branch of government that usually comes from the Secretary of State of any particular state, and or the Department of Labor. Sometimes are sort of overseen by the Secretary of State. Doesn't really matter, but this is the department that is responsible for regulating the various different kinds of licenses, from electricians to massage therapists to marriage and family and counseling and all that kind of stuff. The Wisconsin board that's responsible for what you will be a part of is the Marriage and Family Therapy Professional Counseling and Social Work Examining Board. That's what it's called. And they have their own rules. So what happens is the legislature says, we want to regulate counselors because we think it's important to keep safe, and the citizens have voted and representatives have voted to say, yep, this is important enough for us. We're now giving the power and authority of this board of professionals, essentially a mixed group of social workers, therapists, counselors, marriage and family therapists, counselors, and these people who know the profession, they know what the specific issues are and how to regulate them. We're giving them the authority to make some administrative rules about how to do this kind of stuff, right? So there's a little bit of guidance in the legislature from the regular people and the representatives. There's more guidance in from the licensing board, which are kind of our people, so to speak. So that's why I want to show you the difference. When we look at the Wisconsin State Legislature, this is in your syllabus too, the first link in your on the calendar part. This is what it says in terms of in terms of psychometric testing. By the way, this is the hardest part to change. This is the hardest part to it's the hardest part to get enacted too, and it takes a lot of energy and effort by professional associations and by other just regular people like us, essentially. And the reason that it's here the way it is often because through political disputes between psychologists and the rest of us. So I don't mean to throw psychologists under the bus. I have plenty of psychology friends and people that I know, and there's nothing wrong with any of them. It's not like they're out to get us, but there is this professional history of disagreement and discord that has been going back to the 1930s and 40s, probably, maybe even before that, I don't know, but certainly the 50s. In terms of us getting a 2-year degree, not a full doctorate degree like all psychologists are, but a 2-year degree, are we qualified to perform psychometric testing? Historically, the answer from psychologists has been, you don't know what to do with the information. If you're not trained, it's in the wrong hands and you shouldn't be able to perform these. Okay, so it's not just psychologists, but lots of other people say, if you're only trained for 2 years and you only have one class, you probably can't do these things. So there's some regulation being put into place to say what we can't do. And there's also social workers, marriage and family therapists, and other counselors who say, but here's what we can do, and we have to go advocate and lobby to legislators to change this part of it. Or, which is much easier, we can go to where the statutes are and say, the psychology has their own board. They don't get to dictate the way this happens. As long as it's not in law, we can then self-regulate in our own way. Okay, so we're going to start with the statutes because they're kind of more overarching and more powerful, and then we'll move on to this other stuff. So here's what the law says. Now, it's important to understand too that administrative rules are not laws. We'll look at those next, but laws are more powerful. Marriage and Family Therapy, Professional Counseling, and Social Work Examining Board, these guys, and the Psychology Examining Board should jointly promulgate, some lawyer wrote that word a long time ago, I bet, promulgate the rules that specify the different levels of psychometric testing that an individual who is certified, not us, licensed, us, shall be consistent with the guidelines of the American Psychological Association or other nationally recognized guidelines, ACA, COUNSED, whatever the social work one is. I forget what their primary social work association is, for performing psychometric testing. Okay, so before we can move on, what the heck does that mean? Essentially, the legislators say, we don't want to get involved in this dispute. You guys jointly figure it out. Okay? So there's some joint figuring out of what's going on here. It wasn't like this in Minnesota where I grew up. It wasn't like this in Iowa where I went to school. And it wasn't like this in Montana where I came from. But Wisconsin has apparently a longer history, which I'm not very familiar with yet, about psychologists and other 2-year trained therapists and counselors and that kind of thing of what they can and can't do. So we'll look at that next. But the law says use the APA's guidelines and assessment, use other nationally recognized guidelines, including the American Counseling Association, which is on page 32. If you look at those guidelines, they might seem like they're less complete or maybe less stringent. They're more open for interpretation. But then if you look at page 30 and page 11, and they have these long lists of things that you have to be able to do, one thing that can be helpful to know is that there are some vague parts and less defined definitions of what we can actually perform and what we can actually do. The book is a lot more strict on here are the competencies you need to have, but the professional associations and sometimes the administrative boards are less defined. Now, that gives you flexibility and freedom. It also requires that you are responsible for coming up and knowing what you can and can't do and then being able to justify it to somebody. So for those of you that are okay with that ambiguity, you're going to be fine with this. For those of you that are just like, tell me what I can and can't do, you're going to hate this. But this is the state that we're in. This is the place, the way where we are in the process. So I'll put a little pin on that one in a little bit here and complete this conversation in a second. Let's go to this one. If I download, for the sake of time, I'm getting a little windy here, but for the sake of time, I'm just going to let you know that the part we're looking for is in this number 1, chapter 1, Authority and Practice. I'm going to download it, save it to that thing. Should have had this ready, but I didn't. Sorry. But we're downloading it. And this is what it looks like. Now, in here, this is the part that tells you as a counselor, what are you allowed to do and what are you not allowed to do. We'll go more into this in ethics if you have that with me, or we can talk about this later in some other context if you want to. But I'm just going to go, I'm going to type in assessment, and then I'm going to look here. Here's the part about psychometric testing and the authority that I have to perform it. Now, I'm not going to go through all of this, but it gives us a definition, and we don't need to read that definition thoroughly, but you may want to. A person credentialed by the board may not use a testing instrument for diagnostic or assessment purposes unless he or she satisfy the requirements in sub 5. Which, see, here we go. We're going to start playing this game. Sub 5 is down here, which goes into the educational requirements. Now, for the purposes of what you need to know here, I don't want to go through all this, but here are the educational requirements. I 100% for sure will have covered all these in this class. So if you make it through the class, you will meet all of these, which means that according to this part, you will be credentialed and you will be qualified to be able to perform testing for the purposes of diagnostic or assessment. The reason I'm going into detail on this is if you ever get asked by somebody what qualifies you, here's where you can come back to and say, well, the law, my friend, qualifies me to do this, and my training and experience. So you can read more about what these do. They're for treatment planning. They're for clarifying treatment goals. They're for planning interventions. The stuff that we kind of just talked about in the PowerPoint. Monitoring progress, see where this stuff comes from. Licensing boards look to professionals to say, what kind of things do tests do? And we look to licensing boards to help us regulate these kind of things so that if people try and do this without the right training, there's some means of saying, here's what you missed and here's why it could be hurting people, that kind of stuff. I think that's probably enough. I think you can read through these, but just if you don't want to read through them, I highly encourage that you do. But if you don't, rest assured that I've gone through this and made sure this class is set up to cover all this stuff. So you will have all of that stuff in time. Okay. Yeah, I think that's all I want to tell you. So, thank you for hanging with me for an hour. Like I told you, right about an hour, almost exactly. So, we will talk about this in class. What I'd like you to do, since this is the first one, I'll give you a little more instruction here. If you come to class with any questions prepared, think to yourself about what kind of practice do I see myself doing in the future? Working with kids, working in schools, working in a large facility, working in a private practice, any kind of working on career stuff, working with people with disabilities, just anything that you think might be of interest to you later on. Feel free to bring those questions to class, specifically of how it relates to what is ethical and what is legal. I'm going to probably share with you, if I forget to, you can ask about like, what is the difference between coaching and counseling? It's a hot issue right now. Can a coach just not go to school and say, I'm going to support the emotions of people, but not really treat them? Is that the same thing as counseling? Is it not? Can they use testing as a process for their work? It's really controversial right now. So feel free to bring questions about that, but bring stuff to class that you want to know about this topic, and we'll go through some discussions and I'll kind of lead those too. But anyway, thanks for sticking with me, and I will see you in class. Bye-bye.